Okay. Thank you, Anna, for describing all of this to me in detail. I can only imagine how difficult it might be for you. What I reckon from the entire thing is that you're really going through a lot of difficulty, and there's a possibility that uh, stress might be one of the reasons why you're going through what you're going through at the moment. Are there any questions from your end that I can answer you?
No, no.
Okay. Can we just do a quick examination just to understand what's not okay?
Okay.
All right.
Okay, thank
Thank
you.
you.
You have finished. How do you feel about what you did? It was very nice, by the way. Have you ever been to the cask before, doctor?
No, this is my first one.
Well, it was nice. It was nice. You just subtle improvement in your performance and you'll be perfect. Your introduction was good. The complaint, let's see, just pay attention to your complaint. You must ask about the cause. You didn't ask, is it increasing? Is it decreasing? Okay, you only asked about the associated symptoms. Okay, when you are, you know from the course of her complaint that this is a conversion disorder, and conversion disorder is related to the stress. And you did now, and I hope that all of you pay attention to the mistake which our colleague did. We are all gaining experience and learning. It's not only about one stress. We know that it is an overwhelming stress. So we want to know whether there is any other stresses in her life. Maybe she has emotional stresses, financial stresses. You know, you were sufficed only by the death of her father, but you don't know, maybe she is about to get a divorce. Maybe she has a problem because of her son has some terminal illness. You don't know. Okay, so you want to know if there are any other stresses in her life other than the death of her father. Number three, I know that English is not your first language, but when you talked about alcohol and recreational drugs, you sound as if you are suggesting, have you ever tried to get, you sound as if you are suggesting to me to use alcohol. So,
Right.
okay, so pay attention to the way of your talking. Number three, lastly, it is very important, according to what the feedback from some of the consultants, that you verbalize the diagnosis. So after all the information you have taken from me, I didn't know exactly what is the problem. Okay, there is stress. I know that there are stresses. So what is the problem? You must verbalize it. You have a conversion disorder. It is related to the tremendous stress which your mind couldn't tolerate. So it converted it into physical symptoms. I'll give you leaflets about it, and I hope that we can have another talk to see how we can help you. You don't need to give a deep explanation, but at least in the history taking, you must give a diagnosis, verbalize it, say it. And actually, you had a lot of time. You were very clever. You covered a lot of points in 6 minutes. Okay, so let's see the feedback of our colleagues, and I hope that you pay attention to the feedback of our colleagues. They are all experienced psychiatrists, and the feedback is very important. It's very difficult for me to be the role player and the examiner at the same time. Okay, so only Dr. Kumar. Well, Dr. Kumar is very clever. If he says very good, so it is good. So, so let's see the uh, our PDF. How can we do this station? Okay, so this is a PDF. Okay, so your introduction was good, and pay attention again, doctors, to the way you introduce yourself. It is very important, a communication skill. You must pay attention to this, particularly in the stations in which there is a lot of empathy and good communication in this, like this station, because this is a a lady who is suffering because her father has passed away. In this station, you might get a question, why I'm not crazy, why am I talking to a psychiatrist? There is a typical answer, okay, which you should all know. This is a very common question and it has only one question. I understand your query, the mind and body are one unit, and it is common to have physical symptoms due to psychological reasons, particularly if there is stress and the clinical assessments and investigations are okay. So you expect to have this question in this station and in any other station, by the way, particularly the stations of the liaison psychiatry. Complaint, again, there is a rule for a complaint. You must ask about the onset. You must ask about the course and how was she doing before the onset. Okay, this is how you ask about the onset. It is a part of a skill of the history taking, the onset, course, duration, and how was the patient doing before the onset, because we know that everything in the psychiatry has a precipitating and perpetuating factors. And if you ask, particularly in this station, doctor, because we know that it is related to the stresses. So if it is about stresses, if you ask her, are there any stresses before the onset which happened today, other than her father's death, definitely you will pick up if there are any other stresses. And according to the scenario, I think she had problems in her workplace also and financial problems. It has been said in the station while the role player verbalizes. Okay, then symptoms of the syndrome. Now we know that the syndrome here is a conversion disorder. It is all about the stressors. Okay, the physical symptoms here is not the main problem. It is all about the stressors. So we want to know more about her experience, the stressors. Okay, can you tell me more about your recent stresses and have some details about these stresses and the details about the physical symptoms, and you will find out that she has what is known as label indifference and pinpoint it. Okay, then you can just check it by asking her simple questions. Do you wish to return back to normal? And if you ask her this question, you will find out that her answer is not that she's not very enthusiastic to go back to her normal condition. Okay, and if you ask her about any positive changes around her because of this physical symptoms, you'll find that her condition with her family and also with the work colleagues has improved. Now, the good thing about the history taking task is that the points, point 1, 2, and 3, all are, they are just these points which can be different from one station to the other. But from the points number 4, which is the comorbidity, the impact, coping, and risk, past history and family history, and finally, how you terminate and say the diagnosis, they are all typical questions. Here we have in the comorbidity, the typical question of the psychological comorbidity and the social comorbidity, and then the impact, coping, and risk. And pay attention to how you ask about this. Don't sound as if you are suggesting to use alcohol or recreation drugs, and show empathy when you are asking about this. I'm worried about you. How did this physical symptom and death of your father affect your life? How are you coping? Do you drink alcohol or you use recreation drugs, etc.? Past history and family history. Sorry for this noise. Sorry. Okay. Past history and family history, typical questions, but you must pay attention that in this station, ask her about her childhood, okay? Because the convergent disorder usually associated, not uncommon to be associated with the childhood illness, okay? And at the end, just say thank her and explain for her that she is having convergent disorder. Those who deliver the diagnosis at the end of a history-taking task have a better chance to pass than those who do not say the diagnosis. Okay, so this is for this station. Let's see how our colleague would have been, her score sheet would have been for her. So does not identify the issues and priorities. Now she did, according to what we have discussed. She started with the physical symptoms. She did not deviate from any or start or use any relevant points to start with. First, to recognize significance of aspects of history. The significance of aspects of history are the important points given to you in the candidate notes and the important points which should be covered in the history task. Does not elicit the presence or explore enough details, the symptoms. No, you did. No, this might not be scored for you because you did not ask about the course and the duration and the stressors. So this point might not be scored for you. Risk assessment, you did ask about it. Does not pay sufficient attention. No, you did ask about my opinion about the symptoms. Does not identify appropriate psychological or social information. This point might not be scored for you because you did not ask me about my social life and the other stresses. As for the communication, and again, doctors, pay attention to the communication points. Mostly you do not pass because you fail in the communication points, not because you fail in the technical points. You are all of you are experienced doctors, but your problem is not in these technical points. Your problem in the communication points. And as far as I have noticed, your colleagues did not show any problem in her communication skills. She was very organized. It was not formalic. There was no inappropriate attitude or behavior. Her listening skill was good. Maybe because she was not, she could have phrased the questions more better. This point number 12 might not be scored, or point number 11 might not be scored for her. Okay, I hope that you found it helpful, doctor. My voice is clear, doctors, for all of you. I cannot hear you.
Yes, sir, it's clear.
Okay,
Yeah.
so, well, who would like to go next, doctor?
Are you doing the stations by order or?
No, we not orders. So anyone who is ready, he can start.
Yeah, I can do the hypochondriasis one.
The hypochondriasis. Okay, let's put it in.
لما تيجي نقعد نسمع
طيب عشان بس الحصة بتبقى
يلا حصة.
I'm ready to start when you are ready.
Lot of noise from the outside. Okay. Okay, doctor. Yes.
So what shall I call you in the station? It's written Mr. X.
Robin.
Should I-
Let's call me Robin. Okay.
Robin, all right.
1, 2, 3, go.
Hi, Robin. This is Ayman Yunus. I'm one of the doctors in the mental health team. I have been asked to see you by your doctor. I have a bit of understanding that you are quite concerned about a medical problem, and you have visited your doctor multiple times and other specialist neurologists, I believe.
Well, doctor, I don't want to be rude, but why am I referred to psychiatrist? I'm not crazy.
I understand your concern. No one is saying that you are crazy, and actually we don't see crazy people. It's just I understand that the current stress that you have can affect your mental health, and that's why I'm seeing you at the moment. So I have a little bit of knowledge about what has been going on with you. If you be kind enough to tell me more, what was going on and what is the main problem?
Okay, doctor, I have this brain tumor which causes for me terrible headache, and I just want to do a PET scan because I'm sure that the PET scan is the only investigation technique which will help me to detect this tumor, because I know that it is a very small in the early stages and the routine investigations cannot pick it up.
Yeah, I understand that you have visited neurologists before because you think that you have a brain tumor, and it's quite terrifying idea, I believe. If I can ask you, how long did you start feeling you have a brain tumor?
It started about 6 months ago.
6 months ago, all right. And what raised your concern about having a brain tumor?
Because it is the typical headache which my father had before dying of a brain tumor.
Oh
Brain
yeah,
tumors runs in our family. Okay, there is a genetic, there is a hereditary issue in this damn brain tumor. So I know that this is the same headache which my father used to complain of.
yeah, I'm sorry to hear. May I ask you, when did your father die?
About 9 months ago.
9 months ago. Yeah, I can see. And you say that brain tumor runs in your family as well.
Yes, definitely, because I'm
Yeah.
having the same headache.
May I ask you, have you had any previous headache before this 6 months?
Well, definitely I get headache from time to time, but not like this one.
All right, all right. Has there been any difference now in the type of the headache that you have compared to previously?
No, because it's still in the beginning. 6 months is not an enough period
Yeah,
for the brain tumor to gain a big size, but it is enough to make sure that it is a brain tumor
yeah,
because it is a persistent headache.
of course. Yeah, I understand your concern. And I can see that you have seen neurologists before. Have they done any investigation?
They did investigations, and I did the MRI and the CT scan several times, but I've read that these types of investigations do not detect the early size of the tumors because, as you know, it is not a real image; it is just
Yeah,
a computerized image. So definitely, it will not detect an early tumor. But the PET scan, which I hope that he will allow me to do, will
yeah.
detect it.
And I can see that you have a lot of medical information about, the types of scan, the what scan can detect and what scan can't detect. May I
Yes.
ask you, do you search for information about this
Yes,
subject?
definitely.
All
I
right,
search about a lot because having a brain tumor definitely is a very serious issue.
all right. How long have you been searching about it?
Since I started to feel that I'm having a brain tumor, it's about 6 months
Yeah,
ago.
yeah. And approximately how much you spend of your time searching about it every day?
Well, most of the time, doctor, most of the time, and there are also groups for those who have brain tumors I've been involved in, and I feel that we have a lot of common symptoms.
All right, all right. And have you been speaking to other people about it, like your family?
Well, I've spoken to them. They feel that I'm exaggerating, but I'm the patient, so they don't understand what I'm feeling. They don't have the same feeling. I'm the one
Yeah,
who's having the symptoms.
yeah. I understand that it can be quite distressing, especially brain tumor. It has uh, a difficult
Yes.
prognosis, and you actually have history in your family. I mean, you spoke to neurologists before. Have they reassured you as well?
They have reassured. They did not reassure me. They just read what is in the investigation. So definitely, this is not a very professional thing, because they just commented on the MRI and the CT scan that it is free, but it is not definitely the definite decision.
And with the result of the MRI and CT scan coming normal, has this provided you any kind of reassurance, even for short time?
For a short time, but what do you explain the recurrence of the headache?
I understand this is something that you are struggling with at the moment. I wonder how this affected your day-to-day life.
Well, how do you feel about having a brain injury? Definitely, I'm not able to go to my work. I spent a lot of 1 minute remaining.
Right.
One lot of money for the neurological consultations and doing investigations. You know.
Yeah.
Definitely, it affected my life.
How is your mood being like?
Well, I'm very frustrated because the doctors are not able to pick this tumor.
Yeah. And with this stress in your life, do you have any thoughts that life is not worth living with all of this?
No.
All right.
Want to live, bro.
Yeah. And in your childhood, did you have any medical problem in your childhood?
Yes, I used to have chronic medical problems.
Yeah. How did your family react to this?
Well, they took me to the doctor. How do you feel about it?
All right. So I want to discuss with you my impression about your condition. I believe you have visited your multiple specialists. They have reassured you that there is nothing abnormal to worry about. You have lots of scans, CT and MRI, and this is not.
Time.
All right.
How do you feel about what? It was not bad. How do you feel about it?
I believe I should I asked a lot of questions, and I didn't leave time to assess the risk and to discuss the diagnosis. I believe this was I was trying to discuss the diagnosis in the last 30 seconds, but I couldn't finish it. I believe I should spare some time for that.
Well, it was a good effort. I don't know why did you remove your comment, Dr. Santos. Yeah, it was a very good effort, but pay attention to the following, that introduction must be more fluent. When I said to you why I'm seeing a psychiatrist, I'm not crazy. Don't say that. We don't say crazy people. We don't see crazy people. It sounds confrontational, okay? Just choose another way of answering this question other than a confrontation attitude. It is just say that mind and body is one unit, and the same question which could have been answered in the previous station. When I said that my father died 9 months ago, show some empathy and reflect about this and the diagnosis. And let's see how we can do this station according to our PDF. Yeah, pay attention to the feedback of our colleagues. Okay. Okay, so let's see. Now your introduction could have been better. Why am I referred to psychiatrist? I'm not crazy. I understand your query. No need to say, no, we don't see crazy people. It sounds confrontational. Just talk about the mind and body is one unit. And if there is no abnormalities in the clinical assessment and investigations, there is a good chance that this can be because of a psychological disorder. We can phrase it in many ways, but don't be confrontational. The complaint, you took it in a very good way. Onset, the course, before the onset, okay, and just before the onset, you could have picked up if he has previously any physical problems which did not have any while the physical and the clinical assessment and the investigations were okay. So you want to know if this is the first time for him to experience this dilemma. Now, the symptoms of the syndrome, this acronym, you will not find it anyway. You want to know if this is somatoform, something which is related to a psychological problem. You can have it by the acronym panelized. P stands for progression. Is it progressing to any part, the neck or leg or any part? You'll find that it has nothing to do with what we know about the typical different types of headache, and because there are different types of headache, which I will show you in my PDF. Progression. A stands for the association. If it is associated with any other symptoms other than the headache, we know that if it is severe, it can be associated with a blurring of vision or nausea and vomiting. E stands for the effect. Does it affect the bowel or urine control? If it is organic, definitely it will affect the bowel and the urine. Okay. L stands for what? L stands for, let's see, location. Now, it's, you know, the headache has its own, the location of headache gives us a very good idea about the type of headache. Okay, if it is around the sinuses, if it is a spastic headache because of the tension, the location gives us a very good idea about the type of headache. And in between the investigation, the I stands for the in between and the investigations. Find that in between, he is always checking, he is not happy, and he is doing a lot of investigations. And the sleep. Now, this question is very important. Any organic pain, whether the pain is in the form of headache or any type of pain, usually it affects the sleep. The patient wakes up from the sleep because of it. Okay. Sleep is a very important question. Okay. And his explanation, what is his explanation for this? He said that it is a brain tumor and check it if any. You did not ask me if there is a possibility that this could be any other reason. You must make sure that my idea about this pain is definitely hypochondritis, and I believe that it is a brain tumor. There is no other explanation. It's not just an idea. Okay, and the duration, how long does this headache last? And unfortunately, you did not cover any of this in depth. Okay, how long does this headache last? Well, is it always there? Does he take painkillers? How does he manage this headache?
I believe I asked you briefly, is the headache different from what he used to have before? I tried to be concise in this area.
Why? How can you? You tried to be concise, you missed all of this. No.
Yeah, I mean, I believe in this station, we shouldn't explore the headache in detail because it is not the purpose of the session. He's already been assessed by multiple neurologists and have investigation. So I tried to see if there is a difference between there and here.
Excuse me, there and here? What do you mean?
I
by
mean,
there and here?
There before the 6 month, he had headache before the 6 month, and here the situation now, there is no difference. Yeah.
There and here. Okay.
Yeah.
Well, it's up to you. This is what I know, and this is what has helped our colleagues. If you want to do it as what you have just said, no problem. If you want to dig more and to show that you are professional in assessment of this syndrome to make sure that it is a hypochondritis, okay, it's up to you.
I mean, I don't mind, but I'm speaking about the time, how to manage this in. I already took history and didn't manage the time. How to cover all of this in 7 minutes?
Well, it's because I will tell you why. You wasted time because you are using sentences which can be much less. Okay, right. So let's see. The psychological, this is a type of an anxiety disorder. So exclude the other anxiety disorders. Are you a type of person who gets easily worried about the minor events of life? Okay. Typical questions of the comorbidity, but make sure that you are going to exclude the the anxiety disorders like the generalized anxiety disorders and the phobias, and then ask about the mood and the physical symptoms and the social life circumstances. Typical questions of the comorbidity, as we always say in the history taking task, you have set of questions which you are going to use. When you assess the comorbidity, you are only going to add the exclusion of the anxiety disorder, the impact and coping and risk, you asked about it. But here you must ask me if he is using excessive painkillers. Okay, how does he manage this headache? Maybe he's using excessive paracetamol. We want to know exactly how does he manage and cope with this headache. Okay, you ask me about my childhood, very clever from you. At the end of the station, please, I don't know why did you summarize. Don't summarize at the end of the station. Thank you. From our discussion, it seems that you are having what is known as somatic health anxiety disorder or somatoform pain disorder. Okay. No, it's not somatoform. Sorry, it is a mistake. This is a health anxiety disorder. Okay.
Yeah.
Now, for your assessment here, let's see. The does not identify the issues of priority, you did. Does not recognize significant aspects of history, you did. So these 2 points are going to be scored for you. The presence and explore enough, maybe this point might not be scored for you because you need to dig more to make sure that this is a somatoform pain disorder. Skills and risk assessment, you did demonstrate them. Does not pay sufficient attention to the patient health view. So I expected from you to ask me if there is any, would there be any other reason? Could there be any place for any other explanation? To this point, I know that you just walked around this point. So this point might or might not be scored for you. You asked me about my psychological and social information, but here the psychological, because you did not ask me about the anxiety, because we know that this is the health anxiety disorder, might not be scored for you. I know that there is the typical questions of the comorbidity, but sometimes in some stations you need to ask more, some more questions. As for your communication skills, everything was good, but because you did not reach the, you did not say the diagnosis, it might be considered as poor management of the consultation, so you might use this point only. But it was not for Malik. Not, well, I don't know if he, no, it's not this. No, it was good. It was good. It was good. Okay. Again, doctor, so we have here in this, there are different types of headache. Please pay attention to this. Pay attention to this, doctor. It will give you an idea about how do you cope with this to understand. So you will understand in a better way. Sorry, this is not the. Okay. So, who would like to go next, please?
Can I go next?
Okay, what is your station, doctor?
Specific phobia.
Okay. Okay, so
What name should I call you? What name should I call you?
what, oh, please, where your voice is very low. What are you saying?
What name should I call you with?
Okay, you can call me Christine, but your voice is very low.
Okay. Am I audible now?
Okay. Your voice is not clear, doctor. The doctors are saying that they cannot hear you.
Hello. Am I audible now?
Yes, your voice now is much better. Let's see. 1, 2, 3, go.
Hello, Miss Christie. I am Dr. Nitisha, one of the psychiatrists working here. I got to know from your notes that you have some concerns regarding your mental health. Are you willing to have a chat with me?
Yeah, no problem.
Okay. Can you tell me what has been happening with you recently?
Doctor, I just don't know what's going on, doctor. I cannot just go to this particular place, which is the supermarket near me, and I feel horrible, doctor. The problem is that whenever I go there, I feel I'm not able to go inside the supermarket, and I have to go to a very far supermarket other than this one. I know that this can be a subtle problem, but really it is bothering me.
Okay. I can see that you are very distressed at the moment. Can you tell me since how long has this happening with you?
It started 3 months ago.
Okay. And did something happen 3 months ago?
Well, I was in the supermarket, and there has been an accident in the parking lot. A car struck it was just struck my another car because of the brake problems, and that's it. And it was not a major problem, but you know, since then I feel that it is escalating. In the beginning, I was not able to go to this supermarket, and now I'm not able to drive.
Okay. I am so sorry to hear that you are having such a difficult time. So, can you tell me, are you avoiding going to other places as well by some other transport means?
No, I'm not able to go there at all, doctor. And the problem is that I'm not able to drive.
Okay. And do you experience any physical symptoms when you try to drive?
Yes, I have. So I feel that I'm not okay.
Okay. And what kind of physical symptoms do you have?
Well, I feel that I'm very afraid.
Okay. And what is going on in your mind when you try to drive your car?
I feel that there is something horrible is going to happen, and I cannot tolerate this feeling, and I just flee. I cannot stay in the supermarket. I just leave it.
Okay. Do you have ever any panic attacks?
What do you mean by panic attack?
I mean to say that have you ever experienced so much anxiety that you felt like you won't be able to live anymore?
No.
Okay. Have you ever experienced any nightmares regarding the incident?
No.
Okay. Do you feel startled easily?
What?
Do you feel startled easily at noises?
No.
Do you feel anxious ever at everyday little things?
Yes, I'm a type of person who get easily stressed by minor, but I've been always like this.
Okay. And how is your mood lately?
My mood is I'm frustrated, doctor.
Okay. And how is your sleep and appetite?
They are good.
Okay. Did you ever experience anxiety while you were giving some presentation or were in social gatherings?
No.
Do you ever experience anxiety when you are in open spaces outside your house?
No.
Okay. Uh, And in the past, have you ever felt any difficulty in driving your car or going to supermarket as you are
No,
having currently?
no, no, no.
Okay. And since your accident, it has been happening that you are having difficulty in driving your car. Is that correct?
Yes, yes.
Okay. And do you ever feel so much distress that you think of ending your life?
No,
Okay. Do you ever think of harming others ever?
no, no, no.
How are you coping with all this, Miss Christine?
I don't know what to do. 1 minute remaining.
Okay. Do you ever drink alcohol or take recreational drugs in order to cope with
No, 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 no.
Have you ever in the past visited any psychiatrist?
No, this is the first time to visit a psychiatrist.
Okay. Have you ever taken any medications in the past?
No, no,
Okay. Have you ever had any physical problems?
no, no,
In your family, does anyone have any psychiatric illness?
no, no,
Okay. How was your childhood? Did you have any difficulties in your childhood?
no.
Okay. Okay. Thanks for the information, Ms. Christine. I think that you might be suffering what we call as specific.
Time. Yeah. Okay. How do you feel about what you did?
I don't know, was I empathetic enough, and I was like I was and
Like
I
what?
was
You what? What? I didn't get it.
I was having difficulty in asking the questions a bit.
Okay. Is it the first time for you, Dr. Nadisha?
Yeah. I'm
It's just an anxiety. Just this is the normal course of anxiety. You will start to be anxious, but with time, you will be very professional. But all in all, it was very good. So let's see the feedback of our colleagues. It was formalic. Okay. Also, the physical symptoms. Very clever, Dr. Santos. Yes. You should have dig more about the physical symptoms. Checklist, because when you are very anxious, this is what happens when you are anxious. You get this checklist impression about you. Okay, you just post questions. You don't show any, this reciprocal emotional interaction is not there because you are very anxious and restrained by your anxiety. You look very formal and very checklisty. But all in all, it was not bad for first time. Now, there is no place here to ask about the childhood. Spare this time, few seconds. You didn't need more than 3 seconds just to say that it is a specific phobia. There is no place for this type of questions. Let's see our PDF. Okay, so this is our PDF. Okay, so this is the specific phobia. Again, doctors, show empathy. As I say, if you are very clever and you have all the technicalities, as you can see, all the candidates, their feedback about you is related to your communication skills, are very checked. Let's see, very formalic. Show empathy, and here are some sentences which can help you. Your introduction was good. Ask about the onset. When did this happen? Okay, and ask about the course. Is it increasing? Any particular explanation? Just ask about her explanation. Okay, if you want to exclude if she has any delusion. Okay, any hypochondriasis, and you want to ask her a very common question, which a very common mistake. You want to know how was she doing before the onset. Doctors, pay attention to this. The Royal College now is very focusing about the fact that the candidates should pay attention to the precipitating and the perpetuating factors. Yes, the problem started maybe 6 months ago, but you want to know exactly how was she doing before that, if there has been any stresses, any medications, Okay, is it the first time for her to have such experience? Just show the examiner that you know how to ask about the complaint, the onset, the course, and the duration, and then before the onset. Now we have two here. You don't know the scenario, so you have two possibilities. Can be a panic attack or can be a post-traumatic stress disorder. So we ask about the panic attacks, if she has any particular thoughts that life is going to end and there is an impeding or heart problem is going to help her, is going to happen, and then ask about her feelings, panic attacks, symptoms, the thinking, feelings, physical symptoms, and the behavior of the panic attacks. Okay, and if she is seeking any medical service like going to the ER during these attacks. Okay, and the physical symptoms, which you did not ask about me about it, the physical symptoms. What are the physical symptoms which she is suffering from? But you will find that this is not a panic attack, just extreme anxiety, but did not reach the level of a panic attack. And then ask about the possibility of having a post-traumatic stress disorder. And by the way, you did ask about these two possible diagnoses. And then the comorbidity. Here the comorbidity, there can be some sort of anxiety. You asked me about having a generalized anxiety. I think you did. You did. Hello?
Yeah, I asked one question about do you
Yes.
get anxious at everyday routine activities?
Okay, that's very good. So, and I think you asked me about any physical symptoms. You didn't ask me about if I have any physical problems. You did?
At the end, I asked.
Okay. And the social, did you ask me about my life circumstances? Okay.
No, I
This is
didn't
very
ask.
important. Doctor, this is very important because there is a point for the social and the psychological information which you are going to see in the mark sheet. And again, this is a very common mistake that the candidates forget that there is a social area in the patient's life which they should pay attention to. So did you ask about the alcohol, recreation, drugs, thoughts of harming herself or anyone else? Okay, so I don't know if you should have asked them about them. Past history and family history, typical questions, no need to ask about childhood. And at the end, you should have delivered the diagnosis of a specific phobia. And as you can see, there can be some just visual materials to refresh your mind about the idea or the subject of the task. Don't go through the textbooks to just to stack information. This is not the best way to prepare for the task. Just go through some visual materials which can refresh your memory about the topic which you are going to do the station about. That's it. So let's see. Your does not identify the issues and priorities, which you did. You did identify the issues and priorities. The significance aspects of the history, covered them, does not elicit the presence or explore enough details of relevant symptoms, because you did not ask enough about the symptoms of the physical symptom. This might not be scored for you. Does not demonstrate skills in risk assessment. You did. Does not pay sufficient attention to the patient health view. Now, this point might not be covered for you. All asking. So what is your explanation? This is a very good question to show that you are professional and will help you to cover this point. You want to know what is the impression, how does she translate all this information which she has about her illness? What is her point of view? Number 6, as you can see, social information. Number 6 is about the psychological and social information. Most of the candidates lose this point because they don't ask about the social information. As for your communication skills, you might not score much because it was very checklisty. It was very formalic because of your anxiety, and you did not reach the level in which you are going to say the diagnosis. So that you ran out of time. So this can be considered as a poor management of the consultation. Other than this, everything was good. Very clever, by the way. This is just to show you how to use this mark sheet. This mark sheet should be your reference whenever you are revising. It's not a pass or fail. Very good thought. With practice, definitely you will score all of the points. Thank you so much. Very clear. Thank you so much. So who would like to go next? Yeah, pay attention to our colleagues' feedback. So who would like to go next, doctors? We have 8 stations. We did only
I'll do
3.
one.
Okay, I don't know.
Yeah, actually, I have not booked the station, but it seems no one is coming forward.
Nobody is there to do his station. We have still 6 stations, 5 stations available.
So shall I do one?
Yes,
Anorexia.
definitely. Just give us the time, Dr. Santosh. Definitely.
Yeah, anorexia nervosa.
Okay. Go ahead.
That's mine. I was trying to log in with my computer. Santosh,
Okay,
could you do
Dr.
any
Joyce.
other one?
Okay.
Oh, no
okay,
issues, no issues, no issues, no issues.
No problem, doctor. We are waiting for you, doctor.
No issues, no issues. Then in that case, shall I do the somatoform disorder?
Okay,
So,
doctor.
somatoform,
If
somatoform
anyone
pain
is,
disorder.
yes, no problem.
Is anyone doing somatoform pain disorder? If not, then in that case, I'll do.
Dr. Joyce.
I'm doing somatoform pain. I'm doing somatoform
Okay.
pain.
Okay. Then.
Sorry,
Can I
I
withdraw?
was.
Dr. Santosh, whenever there is anyone is not available, definitely you will take your.
Thank you, thank you.
So. Okay, we are waiting for anyone who is available. If our
Bulimia.
you are
Bulimia.
Dr. Jatin.
Yes, sir. Bulimia nervosa.
Okay, Dr. Jatin. Bulimia. We are going to share our slides just right. Okay. Let's say that my name is Rebecca, and you are going to see Rebecca. I'm ready whenever you're ready.
Ready?
Ready?
Yes.
Okay. One, two, three, go.
Hello, Ms. Rebecca. I'm Dr. Jatin, psychiatrist from Mental Health Unit.
Hello, doctor.
I see from my GP notes that there was a problem with you, that you have been suffering from type 1 diabetes, and there have been instances when you have missed your insulin dose. Am I correct?
Yes, yes, yes.
Can we discuss about that?
No problem. No problem.
Mr. Rebecca, can you tell me why this particular unfortunate incident keep on happening?
Well, I'm just omitting the insulin injections because I'm trying to lose weight, and taking insulin. It just add to the insulin resistance, and it does not help me to lose weight. Everything is fine, doctor, but the problem is that sometimes I mess up in my daily routine of eating habits, and just mess up, and I have high blood sugar level.
Okay. And you're trying to achieve some ideal weight. Can you tell me what should be your ideal weight?
Well, my weight now is 72. I think if my weight is 60 or 61, this can be very good.
Okay. Can you tell me over the last few months, what has been the range of your weight from minimum to maximum?
Well, it has been around 70, 72. Sometimes I gained. I tried to lose weight. I was down to 68, but my eating habits, I need to control them. That's it.
And can you tell me how has been your relationship with the food?
Well, it's very controversial, you know.
Okay.
And, you know, this is a lot of contradiction in what I'm going to say. I don't want to eat more than what I need, but sometimes I just eat more than what I need to eat. And I lose control over eating, and sometimes I'm gaining control over what I'm eating. That's it.
So does this happen in a very short span of time?
It hasn't been always like this, doctor. I just, you know, this happens. You know, this terrible relation with food has been always in my life.
What do you feel when you eat food in a very short span, large amount of food? What do you feel before that?
Well, when it happens whenever I'm stressed, I just go open the refrigerator and eat and just eat. I eat like a pig, in no particular pattern, nothing in particular, just eating. And then I feel so frustrated because I ate a lot of food, and then I try to get rid of it. But sometimes, you know, this amount of food raises the blood sugar level. That's why I've been admitted to the hospital several times.
I understand that you're stuck with these specific food habits. Would you say that you have irresistible urge to eat food?
Well, it's not just, it happens. Sometimes, yes, I have this.
And when you see yourself in the mirror, what do you see?
Well, I feel that my body can look better. As I said, if I lost 10 kilograms, I feel that it will look better.
Okay. And to lose the weight, have you used any compensatory behavior? For example, restricting food at times?
Like what?
Like restricting food at times?
Yes, I try. I try not to restrict my food as more as I try to eat healthy and go through a keto diet, which can also help my diabetes. But as I said, I lose control. That's it.
Okay. Have you ever engaged in excessive exercise to control the weight?
Yeah. This is what I do. I just go to the gym 5 times a week. That's it. Not excessively, but suitable.
How many hours do you do exercise in the gym?
Not more than 1 hour, 1.5 hours. That's it.
All right. And this, do you also engage in any behaviors, for example, induced vomiting or taking some medicines to take the food out of your body?
No.
No such behavior. Can you tell me, Ms. Rebecca, how this has impacted your life? Have you ever had any physical problems due to it?
I have this high blood sugar level, which is not controlled.
Okay. And has this high blood sugar levels landed up you in the hospital with multiple times?
Yes, I've been admitted twice, and that's why I've been referred to you this time. They say that can be related to my eating habits, not the medications.
Okay. Would you say that these eating habits have made you so stressed that you're always preoccupied and you're counting calories?
Yeah, I'm always doing this. Yeah.
Can you tell me how has been the response of your family?
Well, my family is trying to help me, but they don't understand what's going on. And that's it. They are very helpful.
Must be disheartening. Okay. Can you tell me what do you do, Ms. Rebecca?
Well, I'm a student in the college. I'm a college student.
And these eating habits have been interfering in your academic work also?
Yes, yes, yes. In the times of my admission, it also affected my academic performance. 1 minute remaining.
Yes, Mr. Baker, sometimes it happens that if a person is going through such problems over a long period of time, they tend to develop low mood. Will you say that you have low mood?
What?
Would you say that you have been suffering from sadness?
Yes, sometimes I feel that I have low mood, yes, from time to time, but it doesn't last long.
And would you say that your interest in enjoyable activities have also decreased?
No, no.
Can you tell me more about your early family life, your childhood?
Well, what do you want to know exactly?
Did you had any difficulties while growing up?
No, no, no.
Were your parents strict?
No, no, no.
Okay. Oh, all right. Thank you, Ms. Rebecca. From our discussion, it seems that you are going through what is called bulimia nervosa disorder.
Time. How do you feel about what you did? How do you feel about your performance?
I was anxious.
Yes.
Super anxious. I was just going through maybe a checklist. Did not empathize properly. I asked about hospitalization twice. Initially also there was hospitalization, then again hospitalization came in the impact.
Okay, just see the feedback of our colleagues, very good feedback. Okay, so let's see our. So the task here was also assess the positive and negative prognostic factors. So you missed this, please pay attention to the task. This is the first point. Okay. Oh, let's see the feedback. Okay, let's see our PDF. So your introduction. So you should have a good introduction in this station, which you did. And then please be organized. So you must, the complaint is a skill of the history taking. I did not understand. You were just asking questions, but I could not know exactly where did you take the complaint and where did you start to check the symptoms of the syndrome. I did not know exactly what you were doing. So pay attention to this. So you want in the complaint to start by knowing the current situation. How did this all started? Okay, anything happened at the onset, and if there is a course is increasing, okay, and before the onset again, because it has because the eating problems are always precipitated by a precipitating factors. So there can be emotional problems, stresses in her life. Because of this, she started to have an eating problem. Now the symptoms of the syndrome. So in order to dissect and analyze any psychological phenomena, you must know what does the patient think of, his feeling, his behavior, and his physical symptoms. These are the 4 factors. If you cover them in depth, definitely you will assess any psychological phenomenon in a very good way. So you want to know her thoughts. How does she feel about her body weight? How many kilograms she should lose? And if she's preoccupied by the calories, her feelings, how they feel when you eat too much. Does your weight make you less confident? So this is the feeling. And then the behavior, a lot of things to say in the behavior. So what do you do to lose weight? Is it okay to take me through your eating habits? There are many questions which you can ask in this behavior, which is associated with the bulimia, okay? And after eating, how does she get rid of the food You asked about vomiting or exercise, but I felt that your questions were scattered. Okay. And then the comorbidity. And as you can see, she's already assessed physically and has only uncontrolled diabetes mellitus. So no need to ask in details about the physical comorbid disorders. While you are checking the comorbidity, check for the etiological factors. So here is the area in which you can assess the etiological factors to cover your task. Okay. Thank you for being open in this sensitive issue. However, I would like to know if there are any other concerns. How was her mood? Okay, ask about her self-esteem and ask her about the being impulsive. Okay, this is the borderline personality disorders. Okay, and the childhood which you ask about. And social, ask her about the stressors and her family. Again, all these are prognostic factors. Impact and coping and risk. What is the impact of this in her life? I think you asked about this, and if she is taking alcohol. And very important here to ask about the police charges, not uncommon for those who have bulimia to have kleptomania. Okay. Past history, very important also to ask in this. Also, it is related to the etiological factors of any family members has been in contact with psychiatric services, particularly eating problems. Okay. Okay, you have eating disorder. So this is how you cover the task. As you can see, the etiological factors are going to be scattered over the other items of the history taking. Pay attention to this, doctor. You're not going to make the etiological factors a separate or a something which you are going to do out of the sequence of our plan. Check for the etiological factors in the comorbidity area, the psychological, the social, okay, and the past history, and how she is coping. All these are areas which will cover the etiological and prognostic factors. And finally, you did say bulimia nervosa, but I think you missed the time. Let's see the feedback. Yeah, as I said, our colleague is saying that you are not organized. I did not feel that you are entering. Where did a particular phase of this history taking task stops and where the other phase starts? I did not get it. Yeah. Pay attention, Dr. Ayman is giving you a very good feedback. Let's see our does not identify the issues and priorities. Okay, so you did identify the issues and priorities. The aspects of history, it was not organized actually, so I don't know exactly if this can be scored for you. Does not elicit the presence or either of it. You did, but it was not organized. Risk assessment, you asked me about hurting myself or questions of hurting myself. Did you ask me about this question, hurting myself? So this might not be scored for you. It is not uncommon for the patients who have bulimia to hurt themselves. Does not pay sufficient attention to the patient health. I think you asked this. Does not pay appropriate psychological and social information. Here the etiological factors. So this might not be scored for you. It could have been more organized. And your questions were very leading and very closed-ended questions. So these points, 2 points might not be scored for you. Again, doctor, this is not a pass or fail, just to help you to understand how to use this mark sheet. As again, doctors, there are some visual materials. Just have a look at them. It will help you to know what is the bulimia. This will make you more confident, okay? More confident when you go to the station to talk about the bulimia. But don't make your confidence build upon the textbook because it will consume a lot of time. Okay, so thank you so much, doctor. Very clever. I hope that you found it helpful. Okay, who would like to go next?
Can I go next?
Yeah, doctor, sure. What is your station, doctor?
Social phobia.
Social. Okay, this is social. I'm ready whenever you're ready, doctor.
Yeah.
Okay, one. Let's say my name is Mr. White. 1, 2, 3, go.
Hello, Mr. White. My name is Dr. Al-Hijaya. I'm one of the psychiatrists in the outpatient clinic.
Hello, doctor.
How are you today?
I'm fine.
I understand that you've been referred by your GP due to some concern about your upcoming wedding.
Yeah, it is very embarrassing, doctor. I don't know from where should I start, actually. I don't know
Right.
what to do. You know, I'm not good in these situations. I've never been the type of person who do well these gatherings. I've been always avoiding these situations, but you know, my wife insists that I have wedding, and I don't know
Right.
what to do, doctor.
Right. So, okay, let's speak about this. So your wedding is upcoming and your partner, you are a bit concerned or trying to avoid this. Can you tell me more about this?
Well, doctor, you know, if I've been always a type of person who just lose his energy in these social gatherings and being the center of attention of people. I do well on the solitary activities or just few 1 or 2 persons around me, but being the center of attention, you know, I lose control. I feel awkward. I feel horrible, and I just want to end the situation. That's it. I've been always like this, and actually, I don't want this wedding, but I don't know what to do.
Right. So I understand that this has been going for a while for you.
Yeah.
Would you say this has been getting worse recently?
No, it has been always like this, doctor. I just try to avoid the gatherings or anything related to gatherings. Even, you know, I've refused particular jobs, which was a very good opportunities, but because I know that I will not excel because it included being in the center of attention of many people.
Right. And when you are in this kind of social situation, some people sometimes will describe symptoms such as, blushing or being sweaty or shaky.
Yeah,
Do
yeah,
you
it
get
happens. You know, I feel, I feel anxious. I feel sweaty sometimes. Sometimes my hand shake. I feel that my mind is blank. I'm not able to think of anything. I just try to end this situation smoothly, and that's it. It has been always like this, and everyone knows this about me.
Oh, Mr. White, I can only think how difficult and stressful these are for you. And just wondering, how do you respond to these? So let's say you are in a social situation and you feel shaky and sweaty. What would you do?
I just avoid the situation. That's it. I just try to end it as soon as possible. And in the beginning, I just try to avoid this situation. And if it happens, I try to end it as soon as possible. That's it.
So you'll avoid it and you would leave if you find yourself in such
Yes,
situation.
exactly, exactly.
Right, right. And so do you have any difficulty in your social relationship because of this, such as
Well,
with friends or family?
I have to be honest. Yes, my emotional life is very late. Been postponed for a long time. I think I should have had this wedding maybe 5 years ago.
Right.
Sometimes I avoid important social gatherings because that I'm not happy with this type of situations.
I can see that this affected your life, your job, and your relationship with your partner, as well as your wedding plan. Um, I'm just wondering, have you ever seen a psychiatrist before?
No, this is the first time for me to see a psychiatrist.
Okay. And I just want to check a couple of things with you. Would you say that you worry about everything in every aspect of your life, or it's mainly social situation?
No, no, no. This is not. No, I'm not this type of person who gets easily worried about
Okay.
minor life events. No, only this
Sometimes,
situation.
sometime in social situation, people will say they have panic attacks, which is feeling as if they are going to collapse or die, or
Well,
would
I feel awkward. I feel so tense and anxious. I feel so uncomfortable that I want to leave. I can't say that I am in a panic attack and I need a doctor or
okay,
medical service. Just
okay, okay. Sometimes people also avoid going to the shop or taking public transport and they stay at home all the time. Do you experience this sometimes?
no, no, no,
Okay, okay. Some people occasionally will describe fear of specific things such as height or animals or anything
no,
else. Would you? Yeah, yeah.
no.
And Mr. White, how would you describe your mood when you are not in this situation?
Well, my mood is fine. I'm happy, and that I will start my marriage and
Okay,
marital life. Okay, and
okay,
but this particular situation is bothering.
okay. And have you ever take alcohol or any drugs to just cope with this anxiety when you're in a social situation?
No, no, no,
Okay. Is there any family history of similar difficulties
no, no,
or any other psychiatric problem?
no, no.
How was your childhood?
Well, my child was just fine. There is
Okay.
no particular issues. Just
Okay. Would you say that you're being very outgoing child and sociable or more of a shy person?
it has been everything was nice until the secondary state. My wife, one
Okay.
minute remaining
Okay.
until the secondary level of my
Right.
education. But before that, everything was fine.
Right. And would you say anything happened before all this is getting worse? Any difficult situation?
Well, you mean that anything is related to this after that?
Yeah, this kind of difficulty
Well, I
socially.
think that what runs in mind that I had in my secondary education graduation ceremony, I stumbled and all the students laughed at me.
Okay,
And since then, I always have this fear that I might be in the same situation.
okay. So, Mr. White, based on what you told me, I think you are suffering from a situation called social anxiety or social phobia, in which people avoid such social situation and having the symptom described. I can see that you're looking for medication from your GP. So the good news that we could help you with a combination of medication or therapy or counseling. So thank you so much for talking to me today.
Thank you. Very good. Thank you. How do you feel about what you did?
I tried to cover as much as possible. I don't know if I covered everything, but
It was good.
I
It was very good.
yeah,
Very good.
yeah.
I hope that we can have a feedback from our colleagues. Very good. Good station, Sarah, and our colleagues are saying. So it's very good. I don't have any comment actually.
Okay.
It's the
And do you
first
have
time.
Do you have to do a formulation here? No, isn't it?
No, you don't do a formulation. Don't waste your time in formulations, please.
Okay.
Please pay a good question, actually. Understand what is expected from you and do it. Don't add something from, don't volunteer to add something which will not add anything to your scoring and it will waste your time. Okay, so let's see how we can do this station according to our PDF. You did not follow my plan 100%, but as I say, it's up to you. You just the most important thing that eventually you cover the mark sheet in a good way, in your favor. That's it. Nice manner of question, well done. All the candidates are happy with your performance. This is very good feedback.
Thank you.
Okay, so see how we can do it again. Communication skills, which you did have, and these are some sentences which will help you. The introduction was good. With the onset, please, when you take the complaint, you can avoid these, situations which the examiner might not think that you don't know how to take a complaint. The complaint is the most important step in the history taking, and I think the examiners are waiting to see that you are able to take, or any candidate is able to take the complaint in a good way. How did this problem start? Is it increasing, progressing, and before the onset? Okay, the onset duration, and before the onset. Okay, symptoms of the syndrome. As we said before, if you want to know exactly what the psychological phenomena which the patient is suffering from, you can dissect it into feeling, thinking, physical symptoms, and behavior. So the feeling, you want to know exactly how does he feel in the social gathering, any particular thoughts runs in his mind, and if you ask this question, you will know that the main thought which runs in his mind that he's going to stumble and look like an idiot, like what happened before in his secondary graduation ceremony. And the physical symptoms, he will have some physical symptoms, but not major enough, not enough to reach a panic state. Behavior, it was very good, and his behavior is the avoidance or fleeing from the situation. And I'll always ask this question, what is your explanation? This is not just because this PDF is formulated according to the mark sheet. So there is a point for those who pay attention to the patient's health view. So you always put this question in your assessment. Make it one of your questions. Wherever you are going to put it, but make sure that you show the examiner that you are paying attention to his health view, because there is a point for those who pay attention for the patient's health view. The comorbidity, very clever. You ask about the anxiety comorbidity. Physical complaints. He did not ask about any physical complaint. This is very important. Just any change, we know that this is a social phobia. Just ask about the history. A couple of questions, particularly for the thyroid.
Okay.
Social, you ask about the social.
Yeah.
Okay, very clever. You ask about the alcohol and the impact of this problem on his life. But you should have asked about source of self-harm. Okay.
I didn't ask about self-harm. Yeah.
Self-harm, please pay attention. Just show that you are a safe practitioner. Just group of questions, ask them fluently, self-harm, and if he's using any recreational drugs, alcohol, very important. Alcohol is very important in this station because it is closely related to social phobia. Now, thank you for all the information. Typical question of past history for the patient and the family history, and eventually delivering the diagnosis. Let's see the mark sheet. So you identified the issues of priorities, definitely. You recognize the significance of aspects of history. So you covered the details in the symptoms. You covered them in detail section. Though it is not the typical way of my assessment, but you covered them. The risk assessment, I can't say that you covered the risk, though you did not ask about self-harm. So does not pay attention to the patient's health view. Again, you can see this point number 5. they expect from you to have a particular attitude with the patients. This type of collaborative approach, not authoritative. So they expect from you to ask him, so how do you feel about what you are suffering from? What is the plausible explanation for you? Make it always one of your questions to score this point. Does not identify appropriate psychological social information. I think you ask about the social information. Just one other question. So tell me more about your social circumstances. Just one more question. I know that you asked me about the impact of this problem in his life, but you just tell me more about your social information. One or two questions will be enough, because this point is usually lost because the candidates do not pay attention to the patient's health, to the patient's social life. As for the communication skills, everything was okay. I have no comment. Very good, actually. Very good. Thank you so much, Dr. Iman. Very clever, mashallah.
Thank you.
Who would like to go next?
Can I go next?
No, doctor, you don't need to rule all of the anxiety disorders, just the most common. Okay. Okay, yeah. He ruled everything, the most common anxiety disorder. He showed that he knows that the anxiety is a common comorbidity with another anxiety disorder. It is enough. Okay, he does not need to exclude all the anxiety. So what is the Jacob? Who would like to, Jacob?
Somatoform pain disorder.
The somatoform pain disorder is very, very similar to the hypochondriasis. Same set of questions. Everything is same in this station, like the hypochondriasis. Copy paste of the questions. Okay, we'll start within 2 minutes.
Okay.
You ready?
Yeah, yes.
Okay. Let's say that my name is Mr. Brown.
Okay. Can I start?
Yeah, brother. Yeah, I'll start the timer. Okay, one, two, three, go.
Hello, Mr. Brown. My name is Dr. Jacob. I'm one of the doctors in the clinic. I gathered that you were referred by the pain team specialist to see me concerning the back pain.
Well, what is your specialty, doctor?
We are with the psychiatric team now.
Well, I'm not crazy. Why am I talking to you? I just have a back pain.
Okay. Yes, that's a very good question, actually. I gather that you actually saw the pain specialist first because of your back pain, and they did quite a number of investigations. Are you aware of that?
Yes, I know what happened to me. I just want to know, why am I talking to a psychiatrist? I'm not crazy, doctor. I have a back pain. I need a solution for this back pain.
Yes, I understand that that's a very distressing situation to have, and we are just here to help you and get you better. Okay, so the reason why you are here is because the results from what you've done with the specialist came out normal. The blood investigation and other investigations, there were no findings, abnormal findings within them.
I know, though. I know. Well, still, why am I talking to psychiatrists? I did not complain from any psychological problem.
So, yes, that is true. But sometimes there could be when we have tried to rule out every other, symptoms, causes rather, and we cannot find. Usually, we try and see if maybe this could be due to other, due to mental health issues.
Okay, doctor.
All right. That's fine. So, I understand it's a back pain, but when did it start?
It started about 6 months ago.
Okay. Okay. And was there any specific incident that happened?
Well, at this time there was no specific incident, just started. I don't know exactly what is the problem.
Okay. And when it started, did it start just with back pain, or was there any trauma from anywhere, or?
No.
Okay. Okay. And do you have any physical health conditions that could have led to this?
No.
Okay. All right. And I know you've been struggling with this for a long time. I mean, how have you been coping?
Well, I don't know what to do, doctor. I take sometimes painkiller, but they don't work. I'll go to the doctors, they do some investigations, but they don't find any problem. And, it is very frustrating. Nobody knows what's going on. And eventually they sent me for a psychiatrist. I don't know what to say.
I'm so sorry to hear this. It sounds really distressing, what you've been going through, and hopefully we can work out how to help you. So I mean, how bad has it gotten? This pain, has it been affecting your other activities, your daily activities?
Well, yeah, doctor. I feel that sometimes I take a sick leave because I'm not able to go to my work. Sometimes I'm not able to do anything, just lay down on the couch or sleep. Maybe when I sleep for a couple of hours, it improves. So you see, it is handicapping me to a great extent.
Oh, I'm sorry to hear that. So you're not able to go to work. What about your personal relationship?
Well, I have problems with my wife. It's not the best, period of my life. I have problems with my wife.
Right. Okay. Do you have children?
No, I don't have children.
Okay. I'm sorry to hear that this is affecting your relationship with your wife. And have you sought any, others, support with that?
Well, trying doctors to have children, but I have a problem. I cannot have any children. This is why done investigations, but at the same time, my wife wants to have children, and this is very frustrating also to me. But it has nothing to do with the back pain.
I see. Okay. Right. I mean, that sounds really frustrating. Having to add that to what you're dealing with. But I mean, in terms of your mental health, how are you coping? Are you able to, to cope mentally?
Well, I just try to understand what's going on. So I read about this problem. I go to the doctors. I try to take some painkillers, but doesn't help always. And sometimes I just try to calm and rest. I avoid, lifting heavy weights. All the recommendations and advice from the doctors, I do them.
Okay, so you don't have any. Hasn't it been bad to the point where you feel like you want to end things?
No.
Okay. Well, you want to harm yourself by taking, overdose or things like that?
1 minute remaining. No.
Okay. So, I mean, basically, you've said that, this is so bad, it's affecting your life generally, and you are not able to go to work, it's affecting your family. It's also making you, seek a diagnosis. At the moment, since there is no physical health explanation, and there is no other explanation at the moment, we feel that it's most likely called somatoform pain disorder. and it's a situation where you have, you know, a pain disorder that kind of affects all your other, every area of your life. And, you know, what we'll do is we will try and support you and, you know, give you some directions as to how to manage it. Do you have any further questions?
No, thank you.
Okay. If you want, we could also give you a leaflet to print out to, you know, use so that you can have further information on this.
Okay. Fine. How do you feel about what you did?
Okay, thank you so much.
How do you feel about what you did? Okay.
I tried to kind
have
of
you ever been to the cast before?
No, this is my first time.
Okay, yes, you must be ready, doctor. It needs more practice. So let's see how well, a lot of feedback. So I think you will pay attention to what you should have done in while we are having a look at the PDF. Okay, so I hope that you can see this PDF. You stumbled when I said that. I think in the very first beginning, you lost your patient because you did not answer the first, why am I seeing a psychiatrist? As I said, this is a very common question. And if you did not succeed just to address his concern and explain to him the simple fact that mind and body are one unit, most probably you will lose the patient. He might be angry, you know, the role players can be, they might exaggerate things and act as if they are angry and so on. In this situation, you will lose the patient. Okay, so be ready for the answers for this question. Now, the first step in assessment of anything in the history taking is taking the complaint. You want to know exactly how did this start and when did it start, which you ask about, and ask him about the mode of onset, if it is sudden or gradual. Okay, because it gives you an idea about if it is psychological or no. If it is sudden, so definitely there is something which has happened, like lifting heavy weight or trauma or something like this. And then ask him about the course. Is it increasing? Is it decreasing? Is it increasing with lifting weights or movement? You'll find that in contradiction to any other pain or in the back, it is not related to the weights or movement or anything. It is psychological. Okay, and there is nothing makes it increase or decrease. And the painkillers just improve it temporarily. Okay, and before the onset is very important. Again, this is a very important area. It will help you to show that you are professional and pick up the tricks of the Royal College. So before the onset, maybe it started 6 months ago. So you want to know, so before the onset, how was he doing? You will discover that there has been a lot of stresses in his life. He is not able to have babies, and his wife is insisting of having babies and going through the investigations and so on. And again, doctor, you want to know exactly, you want to know if this is the first time for him to have this problem of having a particular physical symptoms without any correlation with the clinical assessment or the investigations. Okay. So as you can see, this is the typical set of questions which you are going to use also in the hypochondriasis. We don't want to use set of questions for every stations. If you watch this and paid attention, the set of questions are the same for the stations. This will make your studying much easier. Okay, so let's see the symptoms of the syndrome. Now you want to know if this pain is psychological or no. Again, this acronym of penalized, I will not go through this acronym again. Okay, penalized. The progression, the location, the nature, the association. Okay, the sleep, the duration in between, and the explanation. Very important, the explanation, because there is a point for the explanation. Okay. This penalized will help you to understand if this is an organic pain or organic headache, or if it is a psychological pain.
Okay.
Then the comorbidity, typical questions, but you will add for them a couple of questions to rule out other anxiety disorders. We know that this is related to anxiety. Okay, the impact and coping and risk but here you must ask him about excessive painkiller. Not uncommon for those who are having pain of unknown reason to use different types of painkillers. It will add on, maybe he is using one tablet, but he is using 4 different types of painkillers, and from each one he is using 2 or 3 tablets. It end up is taking on daily basis not less than 8 or 10 tablets, which is too much. Also, the same set of questions about the past history and family history in the hypochondrisis. How about his childhood? It's not uncommon to have a childhood with a medical problems. And at the end, you deliver the diagnosis. The same set of questions. I'll not go through the mark sheet, doctor, because you need just to study more. It will not be very, it will not add anything. But if you have watched our session today, you understand how to use this mark sheet.
Yeah.
Thank you so much, doctor. Thank you.
Thank you too much.
But pay attention, you must study and practice. Thank you. Who would like to go next?
I'll go next. I want to go next.
Dr. Joyce.
Yes.
So what is your station, Dr. Joyce?
Anorexia nervosa.
Okay. I will just put this. Let's say that yeah, to go talk to Anna. Anna.
Anna.
Anna. Okay.
Okay, thank you.
I'm ready whenever you're ready.
Okay.
Okay.
Just a
1,
minute.
2, 3, go.
Hello, Anna. I'm
Hello.
Dr. Ose from the mental health unit. I understand you've been referred by your GP because of some concerns he's had.
Yes. He asked me to talk with you.
Yeah. What I would like to do is for us to have a chat and see how best I can help you going forward. From your notes, I gathered that you've had some problems with your menstrual period. Yeah. Could you tell me a bit more?
Well, I didn't go to the GP because of this menses, but he said that I must talk with you because of my eating habits.
Right.
The menses has stopped maybe about 2 months ago.
Yeah. If I may clarify from you, why did you go to the GP?
I fainted in the gym,
Right.
and I had to go to the GP.
Yeah. And you said the GP has asked you to see me because of your eating habits. Could you tell me a bit more about your eating pattern? What's a typical day like for you?
Well, I just try to avoid any calories, and I'm now dieting, so I try to lose weight. So I try to make the balance of my caloric intake is in favor of losing weight.
Mm-hmm.
So just I try to focus on this and decrease the restrict the calories as much as possible.
Yeah, yeah. And just to check with you, Anna, for how long has this been going on?
For 6 months.
6 months. I see. And have you had to increase like the things you do just to achieve your goals?
Excuse me, what did you say?
Like you said, you've been counting calories.
Yeah,
You've been trying to restrict your
yeah,
intake. Yeah.
yeah.
And has this habit worsened over this last
No,
6 months?
the same, but you know, I lost. He said to me that I lost too much weight.
Mm,
I go to the gym on daily basis twice per week,
yeah,
twice per
yeah,
day, every
yeah,
day in the week. It has been always the same for 6 months.
yeah. And
Yeah,
how long do you spend in the gym?
about 1 to 1.5 hours.
I see. And regarding your weight, what's your current weight, Anna?
It's 42 kilograms.
Yeah. And what's the highest you've been in the past few months?
Before 6 months, I was about 60 kilograms.
Yeah, I see. And I was wondering, have you got like a target weight?
Well, there's no particular weight. I just feel that I need to lose weight.
I see. So if I get you clearly, in the last 6 months, you've lost about 18 kg?
Yes.
I see. And prior to 6 months ago, how were things with you, Anna?
Well, I had to break with my boyfriend. It was not up to my, you know, my level, and I'm the one who decided to end up with him. I feel that I need to have a better person in my life, and I feel I have to improve many things in my life. So I think one of them is to improve my body shape. That's why I started dieting.
Yeah. Regarding your body shape, did it have anything to do with the breakup from your boyfriend?
Well, maybe, but you know, I'm the one who decided. But I feel that you know, my self-confidence will be better, and I will have a better chance with someone else if I lost weight.
Yeah. Can I check with you, Anna? Would you say you're someone who worries a lot about your body?
Yeah, to some extent, you know, I feel that how I look, it makes a difference. Yeah.
Yeah, I see. And back to your visit to the GP, you did say to me that the reason why you visited the GP was because you had fainting.
Yeah.
Yeah. How long is that the first time that has happened?
Yeah, this is the first time to happen.
Yeah. And other than fainting, have you had other symptoms as a result of?
He's had that losing the menstrual, stopping of the menses is also related to this eating habits. I didn't know, but he said that this can be related to it.
Yeah. Yeah, I do agree with the GP on that, Anna. And are there times when you felt dizzy?
Well, yeah, I feel lately that I'm dizzy several times in the gym.
Yeah, and has all of this impacted on your life in terms of your day-to-day activities?
Yeah, I feel that I don't have the same energy as before. I'm not able to exercise as before. Yeah.
I see, Anna. And I'll just like to ask a few more questions just to know if there are other problems going on.
Okay.
Is that all right?
No problem.
And in terms of your mood, how's your mood been?
My mood is fine, but I feel that I'm a bit frustrated that I need my body shape to be better, but I cannot achieve it.
I see. I see. I know this can be very distressing, Anna, but I
1
just want
minute
you to know that I'm
remaining.
here to help. Yeah. So regarding your and interest, have you noticed any change in terms of the activities you used to enjoy previously?
No, it's the same. I go to the gym. My activities are the same, but the same. I feel lately that I'm weak. That's it.
Yeah. And have you had to use alcohol or street drugs just to cope with the stress? going
No,
on at the
no,
moment?
no,
Yeah. And other than have you seen a psychiatrist before in the past?
no, this is the first time.
And has anyone in your family had similar problems in the past?
Yes, my mother was diagnosed with anorexia.
And just to check with you, Anna, growing up, how was your childhood? Was there anything that stuck out for you?
No, no, no.
I see. Yeah. Thank you for speaking with me, Anna. From what we've been discussing, I do think that you have what we refer to as anorexia nervosa. And I would like to speak with you further just to see how best we could help you. Thank you.
Thank you. Okay, time. How do you feel about what we did?
Well, the task had two parts. One was to take a history with the aim of establishing the diagnosis. And then the other was to assess the etiological factors.
Yes.
Yeah, I'm not sure if I covered the etiological factors
It is
adequately.
a typical task of exactly like the bulimia, and you will see how you can do it.
Yeah.
It is exactly like the bulimia, but all in all, it was not bad. I hope that you give a feedback to our colleague. Anna's probably pregnant until... No, no. No, she is not pregnant. No, Dr. Fuki. No, she's not pregnant. Okay. Okay, let's see our PDF. Okay, so as you can see, very clever that you paid attention to what is required from you from the task. It's not only to establish the diagnosis of the anorexia, there is also a task which is the etiological factors. Again, doctors, don't forget the empathy, very important in our task in general. Okay, so you start simply by asking, just pay attention that the eating is a sensitive issue, and you must justify that you are going to talk about this sensitive issue. So weight and eating are sensitive issues. However, the GP feels that there has been excessive weight loss over the past year or whatever the duration is, which needs to be medically evaluated. Therefore, I would like to discuss this sensitive issue. Okay, are you okay with that? This is how you start talking. Don't go through these sensitive issues without taking a permission. Okay. And now you want to know taking the complaint. You want to know the current situation. So, what is her current weight? How much weight did she lose? Okay. And since when did she intentionally lose weight? Anything happened at this time? Okay, anything makes you desire to lose weight? Okay, just ask about the onset and the course and the duration. And then ask her about her ideal body weight. Okay, how many kilograms she should lose, the thinking, the feelings and behavior, and the physical symptoms. And she already established that she is having a lost or disturbed menses. So just make sure that there are no other physical symptoms. And you want to know exactly how does she lose weight. If she's using lifestyle alternatives, very important.
Yeah.
And how does she feel about her physical appearance? And how does she feel when she eats too much? Okay. And then the comorbidity. Here, as we said before, exactly like in the bulimia nervosa, in the comorbidity, you will check for the etiological factors. Okay, so you ask about the psychological, how has been your mood, etc. And we have here the comorbidity, how does she feel about her self-esteem, if she is perfectionistic. And social is very important in the anorexia. About her family, you must discuss this. Okay, and how did her family react when the family learned about her eating disorder? Okay, the view about the food. What is her family view about food and body image? Any family member that you ask about this question. And how does she feel about her childhood? Very good. So this area is the area in which you are going to check for the comorbidity. Physical, you just check. You already checked for the physical. Impact and coping and risk, very important to ask about this. How did this affect her life? Past history and family history, ask about this. You ask also about if you did not miss, if you missed this, asking her about her social, in his social life, ask her here if anyone has been in her family diagnosed with medical and mental health problems or anorexia, and finally you deliver the diagnosis. It needed just a bit of organization and pay attention that you did not cover the other part of the task. Okay, it was very
Yeah.
good. I will not go through the
Thank you.
worksheet again, doctor, for the sake of time.
Okay,
Okay,
thank
you
you.
so much. Very clever. Okay, how do you, so who would like to go next? Who would like to go next, doctors? We still have how many stations? Nobody wants to take the panic disorder station. Okay, I hope that you found it helpful. Please start from now practicing and having study groups. And please, before paying for any paid course, do your homework and you must study. Just taking courses, you will find that it will not add anything, just it will help you to understand how the exam is going on and will put you in the circumstance of an exam. You can have a feedback, but it will not improve your level if you did not do your homework and prepare well for these courses. So don't waste your time and money. Okay, thank you so much. I hope that you found it helpful. Have a good night.